Good day, ma'am. I am Jovi Balpistan of 2BSNA. Today I will be reciting the Discontinuing and Intravenous Infusion. First thing to do is you have to check for the doctor's order for the IV disconnection. This verification order ensures that the patient receives the correct intervention, and then you have to wash the hands and put on PPE if indicated. Washing the hands can deter the spread of microorganisms, and PPE is for transmission precaution. And then gather all the equipment and bring it to the bedside. This saves time and it facilitates accomplishment of the procedure. And then after that, you have to identify the patient and explain the procedure to the patient. Um, this ensures that the right patient will receive the intervention and it prevents errors. And explanation relieves anxiety and facilitates cooperation from the patient. And after that, you have to clamp the tubing. Um, it prevents the fluid from flowing out of the needle. And then after that, uh, release the anchorage of the arm, the tubing, and the needle. Loosen the tape at the venipuncture site while holding the needle firmly and applying a counteraction to the site. Um, Movement of the needle can injure the vein and can cause discomfort to the client. Counteraction prevents pulling the skin that causes discomfort to the client. Um, Next thing to do is you have to hold a swab above the venipuncture site and withdraw the needle quickly by pulling it out along the line of the IV of the vein. Pulling out in line with the vein prevents injury in the vein. Uh, and then you have to immediately apply firm pressure to the site using the swab for 2 to 3 minutes. Um, the pressure helps stop the bleeding and it prevents hematoma formation. And then you have to hold the client's arm or leg above the body if any bleeding persists. Elevation decreases the blood flow to the area. After that, you have to check the needle or the catheter to make sure it is intact. Then, if it is broken, report a broken needle or catheter to the nurse in charge immediately. Um, if a broke because a broken if a broken piece can be palpated, apply a tourniquet above the insertion site because it can cause serious problems. And you have to apply after that you have to apply the sterile dry cotton balls or the band-aid to cover the IV site because it provides continuous pressure and covers the open area on the skin, preventing the infection. And then you have to discard the IV container and the supplies appropriately because infectious must be disposed in the yellow bin. Um, and then remove gloves and wash the hands to deter the spread of microorganisms. And you have to record the amount of fluid infused on the INO record sheet and on the chart. Include the type of the solution, the time and reason for discontinuing the infusion, and the client's response. Because you have to accurately document the client response. That could be all, ma'am, and thank you. Good day.